Dear students, today is October 15, World Students' Day. It is celebrated to honor the most loved former President of India, Dr. APJ Kalam, who was a scientist, a teacher, and an author. This year, 2020 theme is Learning for People, Planet, Prosperity, and Peace. This day is celebrated to pay honor to the students from across the globe for their hard work, dedication, and determination. Dear students, as all of you know, now due to COVID-19 pandemic situation, various universities are planning to conduct their clinical practical examination for BSc Nursing students as OSCE practicals instead of conventional practicals. So some of you are already exposed to this type of practical examination, but some of you are not. So those who are not will be very much apprehensive about what will be the kind of examination. So this video is dedicated to all BSc Nursing students who are getting ready for their practical examination in the coming days. So let us see what is an OSCE. OSCE is Objective Structured Clinical Examination. It is a type of examination often used in health sciences. Initially it was used in medical sciences, later on now it has spread to other disciplines as well. It is designed to test clinical skill performance and competence in a range of skills. So let us see some of the features. The examinations are held in simulated environment in a lab or exam hall, unlike a conventional examination is held in a hospital with real patients. Here, teacher, students or actors will be there instead of real patients. But all the examination will be adhering to the university regulations. Students will be required to rotate around a number of clinical assessment stations. So there can be different number of stations. It could be 5 or 6 or 7 depending upon the university decisions. It will be multiple short stations or maybe a long station. Okay. So each stations there will be task allotted to the student. The time limit also will be given. Sometimes in between alarm will be given. Maybe if it is for 5 minutes, alarm will be given to you. The time is over. The specific instructions will be kept with each station so that the student can complete the task at each station and move to the next station. And each station will be assessed by an evaluator, especially the procedure stations or the skill stations will be assessed by an evaluator who is an examiner. So these are the examples of stations which are kept. It varies across universities. It's not similar. So each universities have their own pattern. So mostly, invariably, these will be the stations. First, a communication station will be there. An interpretation station can be there, and a procedure station to assess your skill. For example, you will be asked to take the radial pulse of a patient, and maybe another station will be for assessment. Maybe you have a simulated patient and you will be asked to take the history regarding the cardiovascular issues. Okay, some specific task will be given to you and time will be allotted to you and you are supposed to do that. Then maybe a pharmacological station will be given about drug calculation, or will be given a trade name and you'll be asked to write about the pharmacological name and its action and its responsibilities while administering. Then there could be a viva stations. So these are the different stations which can be kept in a OSCE examination, where the student is asked to perform a task and complete within a specific time limit. So there could be different types of stations. Some stations are response stations or cognitive stations. Here you will be asked to write down certain things. For example, you are given a scenario, a patient scenario, a patient X who is admitted with bronchial asthma. So write down the plan of care for the first 24 hours. You are asked to write maybe the priority to diagnosis of this patient and the plan of care which you are going to do in the first 24 hours. Then it could be the next station may be a procedure station. For example, you may be asked to do measurement of BP, or you may be asked to do some procedures. Okay, so in especially in procedures, you are requested to do all the procedure of all the steps while doing this procedure, because you will be evaluated for each step. Then there could also be a rest station in between to relax. Then the time, a set amount of time for each station, and a set amount of time is fixed. It could be 5 minutes or 10 minutes depending upon the nature of the task allotted in each station. So the time varies depending upon the type of question. The total duration of the exam, usual for a conventional exam, is 3 hours, whereas usually for OSCE examination it will be 2 hours, because 15 students allotted in a day has to complete these tasks. So usually it is 2 hours for OSCE. So what the teacher will be doing on OSCE? So teacher will be marking, there will be objective marking criteria or checklist with the teacher to judge the student performance. So teacher will be judging each and every aspect of your performance. So take the examination very seriously. Unlike a conventional examination, teacher will have 15 students, teacher will be moving around between boards, so teacher will not be may not be getting time to look at each and every step of your procedure. But in an OSCE examination, the evaluator will be checking all the steps involved in the procedure. So be very careful in learning the steps appropriately and doing it very correctly, because each and every step will be evaluated based on the checklist or the criteria available with the teacher. What all aspects of the skills are assessed? So there is a great variation between universities and between subjects. So depending upon various, if you are a first year student, if you are a fourth year student, if you are a third year student, if you are a second year student, according to the your level of learning, the type of questions varies, the type of skills assessed varies. So generally, the depending upon your syllabus and the subjects, the questions will be asked. So the cognitive assessment will be there, your psychomotor, your skills will be assessed, your attitude, how you perform, your attitude will also be assessed in this examination. For example, you may be asked to measure a radial pulse, so you have to follow all the procedures, starting from hand washing and explaining the procedure to the patient, and how you stand before the patient, how you explain, everything will be assessed. So just don't take it very seriously to follow all the measures in doing the measurements, even the recording, all those things will be assessed by the evaluator. Then there could be a station for drug calculation, will be given a dose and the actual dose and the available dose, and you are asked to calculate the amount of drug to be given to the patient. And you can also be given CPR. You can also be asked to perform CPR on a mannequin. So do everything very seriously. Maybe for a community health nursing, you may be asked to do a back technique. Maybe for mental health nursing, you may be asked a part of mental status examination. Maybe you'll be asked to do disorder of perception for the patient. Okay, so maybe in the next station you can be asked for to do a restraint for the patient. So what all things you will do for the patient? So like that, the different skills are assessed. Your cognitive skills are assessed. Your psychomotor skills are assessed, and your attitude is also assessed in this type of examination. So you have to be very careful and serious in this regard. So while preparing for the examination and appearing for the examination, pay attention to all these points which are mentioned. First one is a professional attitude. You don't take it very lightly that you are not in the actual clinical situations. You have to demonstrate your professional attitude while interacting with the patient, while doing each and every step in your procedure. The communication skills, ability to undertake the skills, knowledge related to the skill, ability to maintain infection control practices, and the important point, the documentation, which is to be done correctly in the answer sheets provided. So, I repeat, the professional attitude will be assessed, the communication skills. So, you don't think that this is a dummy, why should I communicate? You have to communicate appropriately as in a real settings because you are evaluated. Your evaluation will be done with teachers, so you will lose your marks. So, ability to undertake the skills, knowledge related to the skill, ability to maintain infection control policies, documentation, etc. So in the examination, you have to follow. Similarly, for university examination, all regulations will be same. You are expected to wear uniform and come for the examination. You have to act professionally throughout the examination because there's a university examination going on. Just don't get panic. You can do well because all these years you have done well. Prepare well for the examination. All the best.